In this demonstration, we show how payers rely on Softheon's enhanced direct enrollment integration with the Centers for Medicare and Medicaid Services, or CMS. The integration streamlines the on-exchange application experience for shoppers on healthcare.gov and in states that support the federally facilitated marketplace. A separate demonstration shows the shopping experience for state-based marketplaces. In a prior demonstration, we showed the anonymous shopping experience. This demo shows what happens after the shopper completes the anonymous portion of the experience. The shopper, in this case a single non-smoking male named John Test, is redirected into the enhanced direct enrollment portion of the process. The applicant first selects their state and coverage year. They are then presented with the terms and conditions of the marketplace. Next, John enters personal information that will allow CMS to verify their identity. John enters his full name, date of birth, phone number, and address. When John clicks Submit, he is prompted to answer additional questions that will ultimately verify their identity. Once John has verified his identity, Softheon's integration with CMS searches for any existing applications John may have started. In this case, John has no existing applications, therefore a new application is created. As John enters the next page, he sees that his personal information from his anonymous shopping and other prior questions was automatically added to his application. John now enters additional information such as sex, email address, and phone type, along with contact and language preferences. John also confirms that the address previously entered is also the appropriate mailing address. John can add a spouse or any dependents that may need coverage. In this case, John does not add any additional members requesting coverage. Next, John identifies any professional assistance provided during the shopping and application process. This could include a broker, agent, or navigator. John selects No and moves to the household and income portion of the application. Here, John selects the number of people in the household as well as the total income of the household. The application automatically adjusts to John's selection. In this case, it shows the income thresholds based on a single member household. John then selects the $63,000 or less range. John also elects to see if they qualify for help paying coverage. John is now asked to provide some tax information. This is required in order to receive an accurate tax credit. John attests that the 2025 tax return will likely be filed and that they will not be claimed as dependent on someone else's tax return. Since John is a single-person household, no additional members are listed on this page. He selects Next. If applicable, additional information regarding any dependents will be collected. John checks the box indicating that no dependents will be claimed on the 2025 tax returns. Additionally, John is not the caretaker of a child in the household. As a result, the system processes his status from incomplete to complete. When complete, John can move forward in the application process by clicking Next. The applicant is then asked about their status as an American Indian or Alaskan Native, or if they are currently incarcerated. John is neither. John is now asked for his Social Security number. John checks the box stating that he does not have a Social Security number. If he did, Softheon's live API connection with CMS would automatically check if a valid Social Security number was provided before he could proceed. John then indicates he is a U.S. citizen and is not naturalized or a derived citizen. Optional demographic information may also be provided by the applicant. In this case, John chooses not to make these selections and selects Next. John is now asked about any recent coverage changes related to Medicaid or the Children's Health Insurance Program, or CHIP. John makes the appropriate selection. Optional information about disabilities and their capacity to complete daily living activities can also be provided before moving on. John is now presented with a member summary page. This allows him to review household members. When the information is confirmed, John clicks Next to begin verifying income information. John currently earns $15 an hour working full-time at Sunbeam Bakery in Houston, Texas. Providing this information during the application process allows Softheon and CMS to apply accurate tax credits when enrolling in coverage. Based on the information provided, John's estimated income is calculated. John reviews and attests that the income amount is accurate. To ensure John qualifies for tax credits, the application asks John to disclose any existing coverage and/or healthcare reimbursement arrangements, or HRAs. John confirms that they have no additional coverage or HRA. During special enrollment periods, John's eligibility may also be contingent on an HRA that has been offered, loss of qualifying health coverage, or other recent life changes. Since John is applying during open enrollment, none of these apply. John checks the appropriate boxes and proceeds. Before reviewing and submitting the application, John has the option to receive information on registering to vote. He selects Prefer Not to Answer and continues on to the application summary. When presented with the application summary, John can verify the information is accurate or edit any portions of the application that may be incorrect. After verifying all the information, John is presented with terms of the Affordable Care Act outlining ending coverage due to changes in eligibility. John also has the opportunity to allow the marketplace to access income data via tax returns for more accurate and timely coverage determination. After attesting to the accuracy of the application and providing an electronic signature, John submits his completed application. John is now presented with their eligibility results. The results show that John is eligible for marketplace coverage, a premium tax credit of $379, as well as cost sharing reduction. If John needs to upload any documents, they will be outlined in the Action Items section. All of these results will also be outlined in the eligibility notice that is generated by CMS. John clicks the link to review the document before moving on the enrollment process. After reviewing the eligibility notice, John is given the opportunity to opt in to a full Medicaid determination. Information on how to appeal the results of this application is also available. When ready to enroll, John clicks the Continue Enrollment button. This concludes the enhanced direct enrollment portion of John's shopping experience. With this stage complete, John will move to the next phase of his shopping journey, where he will shop for a qualified health plan via the payer's branded shopping experience. Watch our next demonstration video for more details, or to learn more, visit softheon.com/health-plans.